An initiative called the Bell Review launched on December the 2nd, and its aim is to replace or reform the World Health Organization entirely.
They have too much power, waste too much money, and now they want even more. Something has to change, and change is on the way. Action on World Health has assembled a team of 9 experts who've lost faith in the direction of the WHO, but now want to save public health. Former UN and WHO insiders, public health experts, and international treaty lawyers. Their mission? For countries to take back control of public health from the WHO and protect your personal freedoms.
The United Nations special agency called the WHO was founded in 1948 with a mission to promote global public health, ensure access to essential healthcare, prevent disease spread, and improve outcomes. But it has been criticized in recent years for its heavy pharma influence. The WHO faced widespread criticism during the COVID pandemic for things like its delayed response, inconsistent guidance, and overly close ties to China, which many believe hindered timely action. Additionally, its bureaucratic inefficiency, political influence, lack of transparency continue to undermine its credibility. Perhaps the biggest failure is the WHO's inability to accurately determine the origins of COVID-19. In early 2021, they said that the ground zero Wuhan Institute of Virology lab leak theory was extremely unlikely. But just recently, a 520-page report from the U.S. House Subcommittee on the Coronavirus Pandemic said otherwise. The 2-year-long investigation determined that COVID-19 most likely originated from a lab in Wuhan, China. The report highlights 5 key arguments in favor of this. The virus has unique biological characteristics not found in nature. All cases trace back to a single human introduction. Wuhan is home to China's top SARS research lab with a history of risky gain-of-function research. Researchers at the Wuhan Institute of Virology were sick with COVID-like symptoms before the outbreak. And no credible evidence of a natural origin has emerged despite extensive scientific investigation. In response to the WHO's repeated failures, missteps, and relentless attempts at overreach, an international campaign group called Action on World Health has launched a critical review of the organization. As the WHO continues to falter without any introspection and instead seeks to relentlessly strengthen its mandate, this group has assembled a team of 9 experts, former WHO and UN officials, alongside a seasoned lawyer, to demand bold reforms or, if necessary, a complete overhaul of the WHO's structure and power. Led by Reform Party UK and sitting MP Nigel Farage and Dr. David Bell, a former WHO medical officer, they will assess how a truly accountable international health organization under control of member states should function to effectively tackle global health challenges. They will then evaluate whether reform within the WHO is possible or if an entirely new structure is needed to serve the international community.
We've launched the Bell Review, led by Dr. David Bell, to tell us how the World Health Organization should be reformed or replaced. With Donald Trump now in the White House, we've got the right moment, the right imperative to do this. So please join, donate to Action on World Health. Let's get this thing changed.
According to the website, the Bell Review will draw on established best principles and practices in international public health to critically assess the WHO's current operations and develop a set of practical, feasible recommendations, either to improve the existing framework or to establish a more effective alternative. Phase 1 of the review includes analyzing the principles for an international organization to adhere to, the purpose of an international health organization, its place in the international health landscape, a governance assessment, and finally, identifying successes and failures. That report is scheduled to be unveiled in the spring of 2025. The second phase will address current limitations and approaches for reform, which is set to be released in the fall of 2025. But the World Health Organization is working hard to push through their global pandemic treaty by that time, to again strengthen their mandate by amending things like legally binding international health regulations known as the IHR. Both of these items are set to take place at the World Health Assembly in Geneva, Switzerland this coming May 2025. With the WHO's push for a pandemic agreement under the intergovernmental negotiating body called the INB that holds substantive sessions behind closed doors, citizens in democracies who are paying attention to the actions and conduct of the WHO are concerned about the way it acts in secrecy. Despite the WHO's claims of strengthening global health, the exclusion of citizens from crucial decisions about their very own health and well-being is deeply concerning. This is especially troubling when unelected health bureaucrats, often with strong ties to corporate interests, hold such disproportionate influence over global health policy. Articles within the draft agreement, such as those on pandemic prevention, surveillance, and technology transfer, reveal a focus on corporate partnerships. The WHO's scaremongering about disease X, coupled with its corporate donors like Gavi and its ties to pharmaceutical companies, stand to gain the most from all of this, leaving public health vulnerable to private influence. With billions of taxpayer money at stake, including Canadian funds, flowing into these initiatives, it becomes increasingly clear that the WHO may not be about global health after all, but instead a corporate-backed scheme disguised as a health initiative, making reform or replacement entirely justified. For Rebel News, I'm Tamara Ugolini. You can stay up to date on reports just like this at exposethewho.com. At that website, you can also sign our petition against this pandemic treaty or accord, whatever they end up calling this thing. Sign up so you never miss a report there. Sign our petition and help to offset the costs of our reporting if you can at exposethewho.com.